Welcome back. This is just a brief update on some of the World Health Organization thinking. Now, it does kind of grate a bit to go to the World Health Organization because they missed the bus at the start of this pandemic, in my view, completely, and didn't do a good job at all. But that doesn't alter the fact that a lot of the stuff they're doing now is good. A lot of their thinking is clear and logical at the moment. And a lot of good people work for them. So even though I'm quite annoyed with them in some respects for missing a lot out at the start of this pandemic especially, I think we still have to take note of what they're saying. And we'll think about it and decide what's good and what's bad. And in the recent report, it's pretty good actually. Now, globally, the background to this is officially diagnosed cases now 32 million. But we've looked at pretty convincing evidence in the last few episodes of this video to indicate that they're only picking up about 1 in 10 cases globally through the history of this pandemic. So that means there's about 320 million people, 330 million people, perhaps even more. I would suspect even more than that have already been infected with COVID-19. But in terms of the whole proportion of the world's population, it's still not that many. We're still near the start from that point of view, and we're getting close to 1 million deaths. And in its press conference yesterday, Friday, the World Health Organization is talking about the possibility of 2 million deaths. So this looks like there's another 1 million people could potentially die from COVID-19. And to be quite honest, it depends on what happens in quite a few areas, but given that this pandemic has got a long way to run in many parts of the world, 2 million could end up being a conservative estimate. That is round about the figures we're probably looking at. That was Mike Ryan said 2 million possible deaths. So what to do about it? And this is from Dr. Tedros's opening remarks. First, prevent amplifying events. So-called super spreading events have now been officially recognised as major contributing factors. And we've looked at quite a few of these. There were sporting events that weren't cancelled quickly enough back in March, April. There's been various festival events. We've looked at large meetings in the United States. We've looked at political gatherings. We've looked at protests in the United States. We've looked at protests in the United Kingdom. We've looked at students returning to halls of residence, particular events that can spread the virus quite prolifically. So we need to prevent these super spreader events. And of course, you can't argue with that. What the World Health Organization says there is completely accurate. Of course, we need to avoid these amplifying super spreader events. We need to protect the vulnerable. At the start of this pandemic, of course, we had appalling levels of death in care homes throughout Europe. And in a couple of countries, I am planning to look at this in more detail. There were actually people who were, not to put too fine a point on it, denied potential life-saving medical care because they were deemed to be in vulnerable groups. This is not acceptable. The World Health Organization is saying we protect vulnerable people. This has not always been done. I advocate strongly for it to be done in future. Vulnerable people need to be protected. That's what civilization is. Civilization looks after its weaker members. So I agree with the World Health Organization. Third point they make: educate, empower, enable communities. This is so important. Now, just yesterday we looked at data from the UK that said only half of the population, actually less than half of the population in the UK, recognised the clinical features that would indicate COVID-19 could be present. Therefore, self-isolation and testing should be indicated. And communities weren't empowered to get the testing. We noticed the very small proportions of people that were actually getting tested, the very low compliance with isolation, the test trace, isolate strategy, even though that's working perfectly, people were not complying with it and it wasn't happening. So they're right. This is a good way to summarize it. We need to empower, enable communities, self-help, external help, whatever it is, to make sure communities are enabled to do the right thing, to protect themselves and others, and use every tool at their disposal. We haven't got any dramatic cures yet, but there's many things that we can do that could stop this pandemic pretty well dead in the water if we all did it properly. So what the World Health Organization is saying here makes perfect sense. It's a bit like motherhood and apple pie, really. It's hard to disagree with, and it's fairly obvious. But there again, it is good to reiterate it. Fourth, the World Health Organization is saying get the basics right. Find, trace, isolate, test, care for all cases. We need to do this with all cases. We looked at Italy a couple of days ago. Why is it that cases are so low in Italy compared to, for example, say, Spain, France, the United Kingdom? And the answer is they were getting the simple things right. They were working out who could be infected. They were tracing their contacts, they were testing their contacts, and they were getting those contacts to isolate for 14 days in case they develop symptoms. Getting these simple things right makes all the difference. In the UK, we haven't got it right, and that's why the numbers are rising now. Perhaps over 20,000 people are going to contract COVID-19 in the United Kingdom tomorrow because we didn't get these things right. And that could double in the next week or two. Quite easily, that could double in the next week or two. So trace and quarantine their contacts. So Italy did that and is now reaping the rewards. Let's hope it keeps up. So there are 4 main points from the World Health Organization. Also, effective vaccines are being worked on, diagnostics are being worked on, and therapeutics will also be vital. Therapeutics are very small now. Yesterday we looked at using dogs to diagnose, and I suggested training rats to diagnose as well. These are diagnostic tools which aren't being used, which is a pity. So let's not always think that the diagnostic tools are high-tech, high science. They may be, but also we can think of more community-based things we can do. Every community's got dog trainers, I remember having trouble with my dog, and there was a guy who just knew how to train dogs and trained him up. There's people can do this. Let's use this local expertise, whatever it is. Or maybe your local expertise is just to encourage people. Someone who is struggling with self-isolation, it's been 5 days now, so make that phone call. Have that conversation through the window. Take round the cake. Do whatever it takes. Just help people, These simple things are transformative. So they're all important things. Now, the World Health Organization's latest thing is this access to COVID. So it's a access to COVID tool. So it's an ACT, the ACT Accelerator. So what does this involve? Well, particularly it involves helping low and middle income countries. Now, we've said a few times, and it's true that this pandemic is not over for anyone until it's over for everyone. We have to eradicate this, and I believe we can eradicate this from the world. And the World Health Organization strategy here does make quite a lot of sense. So helping low and middle income countries. Deployment of tools to rapidly reduce the risk of severe COVID-19 diseases globally. Good. So tools to rapidly reduce the risk. Now the problem is, of course, low and middle income countries. The reason these countries are poor primarily is because of corruption within those countries. So most populations are hard working. Most places have some natural resources. Even countries with essentially no natural resources like Japan are affluent because of the hard work of their people. But hard work is sapped by corruption. So in many low and middle income countries, they are besetted with corruption. And of course, not only does that mean they can't afford to buy the things they need to buy because the money's been siphoned off corruptly, it also means that resources that are put into those countries have to try and work through corrupt infrastructure. So it's remarkably difficult. And this is why we need good quality men and women on the ground everywhere who are not corrupt. So it is difficult, but the World Health Organization are focusing on those places. And by the end of next year, the Accelerator aims to deliver 2 billion doses of vaccine. Now, next year is 2021. So this is, the end of 2021 is September, October, November, December, 12, 13, 14. This is 15 months away. Quite a long time. And that's only 2 billion doses. We're going to need more than that. So their ambition, which is not yet financed, is to produce 2 billion doses of vaccine by the end of 2021. This is simply not fast enough. It is not good enough. It's a pity that there's so much corruption-induced poverty around the world that means this is going to take much longer. But also, because this is an emergency, we still need richer countries to supply these vaccines, so that this is one millstone that poorer people will no longer have round their necks. We really need to work together as a global community here. They plan to push out 245 million courses of treatment, 500 million diagnostic tests. 500 million diagnostic tests, and that too shouldn't be there. But the World Health Organization is currently working on new tests as well, evaluating more than 50 tests. So these are things that they want to do as part of this Accelerator, all very laudable, or will unfortunately be hindered by corruption around the world. Let me ask you a really hard question. Who suffers as a result of corruption? You know the answer to that. It's always the poor people that suffer as a result of corruption. So the World Health Organization is evaluating 50 more types of tests at the moment. Good. Saliva tests, all sorts of different tests. Rapid and accurate diagnostic testing. Now, a bit of a tantalizer here from Dr. Tedros. More on that next week. So I wonder what he's planning on announcing next week. Let's hope it is a very cheap 50-cent, $1 test that is completely accurate. Maybe he's announcing that they're going to start training up dogs and rats. I don't know. We'll have to wait and see. Both would be good. Analysing the results from more than 1,700 clinical trials. The problem is most of these are very low quality. We need good quality clinical trials, like the British Brace trial that demonstrated that dexamethasone worked. We need good quality clinical trials on whether vitamin D works or not. I don't think it's being done. I remember right back in January, February, the World Health Organization proudly announced that 80 clinical trials were going on into therapeutics in China back in February. And since then I've read the results of some of those clinical trials and they're not very good. So 1,700 clinical trials sounds dramatic, but it's quality of clinical trials we need, not quantity. And that is still sadly lacking. They've secured doses of dexamethasone for 4.5 million patients in lower income countries. Given that dexamethasone costs absolutely nothing, literally I imagine producing 1,000 doses of dexamethasone probably costs less than $1. So given how cheap it is, 4.5 million doses is nothing. That's not impressive. Dexamethasone should be available for every person in the world who has got a doctor to prescribe it to them when they have when they need supplementary oxygen or when they need ventilation. We know that dexamethasone works in those circumstances. 4.5 million doses, not impressive. And I know of Indian pharmaceutical manufacturers who can make this by the ton. for virtually no money. And why is that not being done? It should be. You know, the idea that people would die now through lack of dexamethasone is really appalling, but it appears to be the case in some places. And the World Health Organization did add that this is the only medicine known to reduce the risk of death. Right, so get that. This is the only one, and I agree with them here. This is the only medicine where we have randomized double-blind controlled trials to show it works. Now, on this video, we have presented evidence for hydroxychloroquine, which appears to be effective in the community situation. We've looked at studies from different countries that shows that it appears to work from observation and correlation studies. But unfortunately, the clinical trials that were carried out on this seem to use a rather high dose. So we don't have clinical trial data on that. We need another trial of hydroxychloroquine, for example. There's other drugs we could mention, at a much lower dose, but I don't know that it's being done. It's a real pity, but as of now, the World Health Organization makes a completely true statement. The only drug we know reduces the risk of death so far is dexamethasone. That's it. Now, the coronavirus vaccine program, to get it to everyone, they're supporting the development of 9 vaccines at the moment, which is good. 67 high-income countries have joined. 34 are expected to sign, so that's good. 92 lower-income countries are eligible for support through the COVAX scheme. Let's hope it's given out legitimately and non-corruptly, and that people aren't charged for it. Financing the Act Accelerator, they need another $35 billion US. Hard to see where that's coming from, to be quite honest. Hard to see where that's coming from. Dr. Tedros pointed out that $35 billion is roughly what the world spends on cigarettes every 2 weeks. And this will be a great investment in the global recovery. So there we go. I mean, we really need leadership. And the World Health Organization has been the natural body of leadership. But the problem is many people think it's been politicized, and they certainly were less than impressive at the start of this pandemic. But let's not throw the baby out with the bathwater. If they can help now, I'll accept it. You know, if someone says to me, do you need any help? I'll say, oh, all I can get. Okay, thanks for watching that brief update. Always good to have you back again. Thank you.